Medically assisted procreation, indicated by the abbreviation PMA, indicates all those techniques aimed at helping conception in all couples who have problems having children, and in cases where other pharmacological and/or surgical interventions are inadequate. They can be homologous if the sperm and/or oocytes come from the couple concerned, or heterologous if they come from donors. In the last video, which you can find by clicking above, we saw what artificial insemination is and how it works. In this video, we will go to see in detail how in vitro fertilization works, in particular IVF. A second-level technique, therefore more complex and invasive. Fertilization occurs in vitro, in a test tube, i.e. outside the woman's body. How does it work? In vitro fertilization begins with ovarian stimulation. The woman begins this treatment by administering gonadotropin-based drugs through injections for about 10-14 days in order to stimulate the ovaries to produce more oocytes. This procedure is necessary to increase the chances that fertilization will be successful, since without ovarian stimulation, the woman would produce only 1 egg per menstrual cycle. More eggs are needed because some do not fertilize or develop normally after fertilization. The more embryos that are transferred to the uterus, the greater the chances of implantation. During the period of ovarian stimulation, to evaluate the development of follicles, the patient is periodically subjected to control ultrasound scans and blood tests to check the level of some hormones. When the follicles reach an adequate size, ovulation is induced through the administration of a drug based on HCG, human chorionic gonadotropin, which occurs on average 36 hours after its intake. This hormone contributes to the final maturation of the oocytes contained in the follicles and to their detachment from the follicular wall. At this point, you can proceed with the egg retrieval, also called pickup. It is a procedure that allows to recover the oocytes that have reached maturation after ovarian stimulation through a transvaginal aspiration under ultrasound guidance. An ultrasound probe is inserted into the vagina, to which a thin needle is connected, which through the vagina reaches the follicles present in the ovary. At this point, they are penetrated by the needle to aspirate the internal follicular fluid, with consequent collection of the oocytes contained therein. The follicular fluid will be collected in a test tube and then immediately delivered to the biologists. Thanks to the microscopic evaluation, it is possible to check how many oocytes are present in the liquid and to analyze their maturity. At this point, you can proceed to in vitro fertilization. At the same time as the woman's oocyte retrieval, a seminal fluid sample from the male partner or from an anonymous donor is collected, which will be prepared in the laboratory with techniques that serve to promote the fertilization capacity of the spermatozoa. In the same plate, where the oocytes are kept, recovered thanks to the pickup, the spermatozoa are added, and the egg cell penetration is expected to occur naturally. Thus begins the culture of embryos, where the necessary conditions are created for their correct development for a period of time ranging from 2 to 6-7 days. Sophisticated technology is required to reproduce in vitro the physicochemical conditions that characterize the maternal uterus. The plate is kept in culture inside incubators under controlled conditions for 18-20 hours. After this time, it is assessed whether fertilization has occurred. A normally fertilized oocyte, zygote, shows the presence of 2 pronuclei which carry respectively the genetic information of maternal and paternal origin. The zygote is then placed again in culture and checked every 20-24 hours to observe the embryonic development up to the transfer. After 5 days, the embryo must have reached the blastocyst stage, consisting of about 100 cells. It represents the stage of development, where implantation begins in the mother's womb. It is possible to proceed with the transfer of embryos into the uterus. Only the best embryos are chosen for the next phase, i.e., those with certain characteristics. The number of embryos is then chosen by mediating between the possibility of failure and a possible multiple pregnancy. Instead, those that do not evolve correctly, and therefore not suitable for creating a pregnancy, are discarded. To increase the probability of success, preimplantation genetic diagnosis can be performed before the transfer to verify the absence of chromosomal alterations and other serious pathologies of the embryo. At this point, the embryo transfer takes place. It is necessary to have prepared the patient's uterus, making sure that the endometrium, inner layer of the uterus, has reached a thickness sufficient to receive the embryo and promote pregnancy. A catheter, long, thin tube, is inserted into the uterus, passing through the vagina and cervix. A syringe is placed at the end of this catheter, which contains one or more embryos, placed in a culture liquid. Using the syringe, the embryos are gently released into the uterine cavity. At least one of these embryos will be expected to nest in the uterus wall approximately 6-10 days after the egg retrieval. If more embryos have to take root, the couple can opt for the so-called embryo reduction, i.e., reducing the excess embryos compared to the desired number. Multiple pregnancies carry greater risks than single pregnancies. Excess embryos are destined for cryopreservation in order to be able to proceed with a new transfer, even after some time, without having to repeat a new ovarian stimulation. Approximately 2 weeks after the transfer, pregnancy tests can be carried out in order to know the outcome of the procedure. Who is in vitro fertilization suitable for? What are the probabilities of success? In vitro fertilization, according to the guidelines, is suitable for failure of first-level assisted reproductive techniques, damaged or occluded tubes, severe endometriosis, low egg quality, ovulation disorders or uterine fibroids, moderate male infertility, spermatozoa with poor motility or with abnormal shape and size. In vitro fertilization is a procedure considered reasonably safe but not entirely risk-free. The success rates of in vitro fertilization are on average 35% if the woman is under 36 years old, up to percentages of less than 9% for those over 40.